We're here today with Dr. Huang, CEO of the Retina Center of Ohio in Cleveland. Welcome.
Thank you.
Thank you so much for joining us. And we might as well just get started. So what advice do you have for ophthalmologists in managing their practices in these uncharted waters of COVID-19?
There's no question that right now is a really uncertain time from every single standpoint. It's uncertain for our patients, it's uncertain for our world, our communities, and it's uncertain economically, to be frank. The guidelines that have been laid out, no one knows how the pandemic will spread, whether it affect your community early or late, or what we might do. So this is an opportunity for leadership. In crisis, there's no particular plan that you can follow. If you have planned for a few things, that you may be able to mitigate some of those things. But fundamentally, this is an exercise for leadership, both from the physician and administrative or management staff of your practice, depending on how big it is. I'm in a solo practice, a solo retina-only practice in Cleveland, Ohio. And so the advantage of our practice is that we're small and very flexible, and the disadvantage is that we're small and highly susceptible to changes in the market. So there are 5 sort of things that we try to do that are opportunities for leadership. The first is to project what we call a knowledgeable reassurance. They're going to look to you to say, how bad is it? Is it going to affect me personally? Is it going to affect my associate and the family? So we have a tripartite mission to worry about our staff, to worry about our patients, and then to comply within the larger community of public health. We want to keep everybody safe while continuing care for those who need it. The important thing then is that you need to think, as a leader, you need to think short term. What needs to be done right away? What needs to be done in the near future? And how do you plan for long-term strategies in case this turns out to be the unthinkable? What is the very worst that can happen? And every day there are things that roll out that give you options. For instance, the CARES Act was passed. That didn't exist prior, and without that, the situation may very much change. The Small Business Association Disaster Relief Fund is a wonderful godsend that will help get us through at least a small portion of that time. And then the payroll protection program would allow you not to furlough employees if you receive it, for a period of up to 2.5 times, 2.5 months. That will help you tide your way through. But there's no question that the statistics are bad, that 12.7 million people lost their jobs in the last 21 days. So when we're thinking about the crisis, think about your staff first, think about your patients, and think about the community, and put yourselves in their shoes to address their concerns first. As a leader, you have to address all of it. You have the whole picture, and to project knowledgeable reassurance is the best thing to minimize anxiety. You need to work the problems. If there's a problem that might happen, that is less important than one that you need to address right away. And in addition, you make the weather, meaning that if you project anxiety, uncertainty, anger, fear, then you can be sure that your staff and your patients will also feel that. So you need to be concerned, but taking action and working the problem.
Mm-hmm. Well, can we circle back to how does one plan in this time of constantly shifting priorities?
Well, I think the important thing first is we've called it a war, and it really is. Public health is always a war. You have to think of your troops, if you will. Your staff is very important. We need them in all regards. And most practices, honestly, are very lean. They don't have a lot of extra capacity. If someone gets sick, that means the whole office is likely to be quarantined. If the doctor gets sick and they can't even see even a limited amount of patients, everyone's affected. So I like to start first with at home, thinking about what is of greatest concern to our staff and our administration, and of course our physicians. And if we're not around, we can't take care of our patients. So those are the three things that I think about. And of course, we need to comply with the larger guidelines of social distancing and cleaning practices and so forth.
And how does one reassure their patients in a time like this too? What do you say, or what message do you convey to them?
Well, I think it's a really good point, because I think every patient is different. So it's not perhaps a cookie cutter. So on the one hand, you have patients who are undergoing active care. They need the retinal detachment surgery. You have to reassure them, we will find a way to do that safely. Number two, if you're under continuing care, if I don't receive my treatment, I know that if I wait even a week too long, my vision starts to go down. We will see you. We'll make sure we have plans to see you. Number three, will they get sick? What steps are we taking to prevent us from infecting them? We assure them we have a complete sterilization protocol. We have social distancing. We clean each room before, we foam in and foam out. And every single time there's a chance we are hand sanitizing, and they make them part of the process. Before they approach the front desk, we ask them if we check their temperature, we see if they've had any exposure, and then we ask them to use hand sanitizer before they even pull out any piece of documentation. If they have any of those things, we assess and we turn them right around and send them out the door. So that helps everyone. Second of all, then the question is, are we well? So patients want to know, hey, are any of you sick? So we tell them we are all well, and we are taking the best precautions that we know how and the best that are recommended at this time to keep us safe and them safe. Now we're working together. And so that's how we approach patients. Now for patients who are well and they have non-emergent, non-urgent, and non-continuing care, they may say, I'm an elderly patient. Most of our patients are elderly, above 65 years of age, with multiple risk factors. Should they come in for glasses or your annual diabetic check? We tell them no. We have a proactive program to contact patients and talk to them, reassure them, tell them what's going on, and asking them to voluntarily move their appointments back 6 weeks. We've done that twice now. So we've pushed patients out 6 weeks and saying if the guidelines are relaxed, we will be contacting them and having them come in. In addition, we want you to use social media as well as email, but many patients, almost a third, don't have either. So we send letters as well, but we keep them up to date with video chats such as this, communications, emails, just to let them know we're here every day for emergencies if you need us. And that we find has been very reassuring. We're not asking them to come in and exposing them to risk unnecessarily, but we're here if they need us.
Okay. And what lessons or best practices can be learned from a situation like this with crisis management?
Well, I think it's difficult to know. Every crisis is a little bit different. But I think one of the things, and this is true for all kinds of disaster drills, that's why every office should practice a fire drill plan, what to do if there's a fire, what steps are to take, who's in charge of what, and we practice by closing doors, shutting down, and planning 2 routes of exit. What do we do if there's an active shooter or disruptive patient? How do you handle that? And again, you can practice that. So this, like many others, we can practice things where either there's a financial crisis, let's say the doctor becomes ill and unable to practice. That's another kind of disaster for the practice and for the employees. So those can be planned for, but it's all a matter of proper prior preparation. If you prepare properly, you can mitigate, you won't be so anxious, but there'll always be new problems that have been unanticipated that you have to work.
And lastly, how do you envision a practice of the future might look after this coronavirus pandemic is over? Will there be virtual waiting rooms, or what do you envision, what changes do you envision will take place?
But again, it's a very good question. I think some of the things will definitely change. In many parts of the world, for instance, wearing masks and shaking hands and kissing is not usual. And I think there'll be less of that. Dr. Fauci recently said that perhaps handshaking might never come back again. I'd hate to think that we couldn't hug in the future. We hate to think that we couldn't clasp hands and kiss our loved ones. But for general practice, I think we will do less. We'll wave, we'll handshake, we'll bow, or we'll nod our heads perhaps, and we won't necessarily touch. I think the sterilization procedures, even now, patients can be asymptomatic for 5 to 11 days. They may have the virus. So from a hygiene standard, from a public health standard, every patient that comes in, no matter how good they look, have COVID, have hepatitis, have AIDS, have the flu, have whatever. And so that things like washing your hands and foaming and disinfecting rooms probably will just become standard. But after this current is over, maybe in a year and a half when we have a vaccine, we'll go back to the practice of developing a warm relationship with our patients, caring for their eye needs, helping them. We feel that practice will resume because people need their eyes, they appreciate their vision. And I think that we will get back to that. I think there'll be more telemedicine, not necessarily for ophthalmology at the moment, but there are screening programs. We'll have better ways of perhaps having video chats with people when they are calling in for a complaint. They have a red eye. Well, let's have a look at that red eye, see how that looks. Mm-hmm. Some of that can be done, not so much for the retina at the moment. For other general things, perhaps telemedicine will be part of our future. Mm-hmm. Whenever there's a crisis and the office is closed, you should be flexible in thinking about whether there are opportunities for your practice. Your volume is down 70 or 80%, but the staff as well, how can we work from home? Generally, we can't. But because they're home and because they have time, they can do something very important. They can call patients. They can call patients and reassure them and say, how are we doing? How are we responding? We want to remind you that if you have, if the restrictions are lifted, we'll be calling you to come earlier. That relationship, you can't do that when we're driving around the track and trying to change the tire, but now we have time. We have time to practice other kinds of disaster drills, to look at office efficiency. And it's especially important for practices like ours, where we do clinical trials, to contact clinical trial patients and reassure them. What am I supposed to do? Am I supposed to come for my protocol visit? Will that put me at extra risk? Or will it be part of actually continuing the care that's going to actually help them see better? That is the relationship that we can actually spend the time, 10 minutes, 15 minutes, which normally we wouldn't have. So it's a great opportunity to engage with your patients, to develop your market brand, which is to say we're a caring practice that delivers personalized medicine, and also to prepare for when patients return. Because I think we'll all be very, very busy, just like restaurants and movie theaters and ballparks. People will want to go out and they want to get this done. And especially if it's their eye care, they'll want to be back. So we need to prepare for that too. So I think there are a lot of opportunities, even in every crisis, to do things that perhaps can change you for the better for the future, or make you more efficient, and help you cope with the anxiety of dealing with the stress of the moment. There are 5 things actually to mitigate anxiety, which I think are important. The first is to normalize anxiety. Don't tell people not to worry. They should worry. This is a time of worry. But that worry is good. It helps us make actions. So we can channel the energy into action steps and to learning steps. We can learn more about the disease. We can take steps. And that's one way to channel anxiety more usefully. You can also offer perspective. As a leader, it's important because you may understand the molecular biology, you may understand the epidemiology. You also may understand the financial aspect and help people, even if it's to help them apply for unemployment. That's a knowledgeable perspective that lowers the anxiety. There's steps we're going to take. This is going to happen. It's not going to last forever. 97 or 98% or 99% of people will live. There are some who will die, maybe many will die, but that probably isn't going to be you. So that's perspective. And then shift the spotlight. Sometimes the most anxiety comes when we focus only on ourselves. What about my job? What about my family? But if we can say all our lives, we have focused on helping others. And by helping others, by calling and reassuring others, That may reduce the anxiety of our staff and give them something to do. It's terribly, terribly important. And for those who are just, they look at the news 24/7, they become distracted, they become depressed, very anxious, encourage them to take a break, to take a walk, to do something else. The news will still be there when they get back to it, but they don't need to do it all the time. That also lowers anxiety. And then lastly, whether it's the physician or the staff or anyone in your organization, if you can lower your own anxiety, manage your own anxiety, try to be calm, try to be reassuring, that will help them. And in turn, your staff will project that calm to their family, to their friends, and they will be able to do those same steps to lower the overall level of anxiety. I think that's really, really important. In any crisis of any kind, calm heads, reassuring action, and leadership, I think, are the watchwords to managing things as best we can.
Some very good advice there, and certainly I'm sure will be well received. So again, thank you so much for your time, Dr.
Thank you.
Huang.
It's a pleasure.
I appreciate it, and hope you have a great day.
Thank you.